am Renee Walters, the nurse manager of the Cardiovascular Progressive Care Unit at the University of Kansas Hospital. When you say everything you do is about improving the patient experience, the patient satisfaction will also increase with that. So we didn't look at saying, let's improve our scores. It was, let's make this a better place for patients. Let's find out what they need, what the staff need to provide excellent care, and patient satisfaction increased along the way when we put our priorities where they needed to be. It is not just our responsibility to provide great patient care to the patient, but also to realize that their families are an integral part to them, which means it's an integral part to their wellness and their health. And so as a nurse, I want to be just as attentive and caring to them as well. I don't believe there's any substitute for rounding on a unit. The only way that anyone can ever know what's going on in any environment is to be present. You have to be there where the patients are and where the staff are to truly appreciate what's going on. It's also an amazingly rewarding time because you get to feel and see what occurs to provide excellent care. At the University of Kansas Hospital, we measure patient quality indicators. What that means is we're looking to see, are we doing things correctly? Are we providing safe care? Are we labeling our specimens correctly? Are we providing medications in a timely manner? Are we assessing our patients accurately? And we actually measure every individual key component to the patient care process. So at an academic medical center, you're going to see the people that are not afraid to hear that something needs to be improved. In fact, they're looking because they already know that everything can be improved. I think the most important thing to make patient satisfaction a priority on your unit is to talk to your patients and actually listen to each individual patient about what's important to them. You can't say that there's a recipe per se for what's going to be right for every single patient. So the key is creating an environment where it's important to every person on a unit or in a hospital setting that the patient experience is important to them. I can honestly say every time you take a warm blanket into a patient and they look up at you like that was the most important thing to them, that's an amazing day. So truly, when you're looking at patient care, it's not about the big moments, it's about the everyday things that truly impact people. You can't teach being kind. You can't teach people to care. So you need to look for individuals that's the essence of who they are. So at the University of Kansas Hospital, we're recruiting employees that love taking care of people, that feel like that is a core value to them, that being nurturing and kind and caring is the essence of who they are. You're constantly assessing how we are doing, and we're also trying to be visionary about what we need to do to continually improve. One of the ways to do that is to make a very open communication with staff as well as with patients. Just actually, the other day I was meeting with a patient in my office, and he shared that he has difficulty seeing. And so he and I communicated, and I asked if he would share what font would have been more appropriate for his discharge instructions, so that we could then increase the size of his discharge instructions so it's better for him. And he's actually going to come back and speak to my staff about how we could have better met his needs. And he personally felt like we did an exceptional job. However, with every experience, there's always an opportunity to do a little bit more. On our unit, we talk about how change is essential. It is the key component. If you stay stagnant, you'll never improve. And I use that philosophy for how we're going to talk to each other when we see something we could do better. When our communication wasn't caring, when we were not polite, when we did not follow a protocol exactly correct, you always communicate in a way that shows care. On the Cardiovascular Progressive Care Unit at the University of Kansas Hospital, teamwork is essential. And building that team means, one, identifying their strengths and letting them know that these are the things that we are doing very, very well. When I see something that is done, and it's done in a manner that was just amazing, I like to let them know at that moment. If I see someone walking down the hall and they were courteous, at the appropriate moment to let them know, I love the way you were talking to your patient. That was great. If I see someone doing a procedure and they did it well, it's acknowledging them at that moment that you did technically an excellent job with that procedure. Once you identify those right people, it's supporting them and creating an environment where they can grow and develop, and they know and understand that it is their responsibility, their right, and their privilege to take care of patients.